This is Analytical Media. We are a consortium, a group of therapists, college professors, and well-published peer-reviewed authors. You can find our book on the subject of psychopathy entitled Descent into Darkness at Amazon.com. That book analyzes the murder of Travis Alexander by Jodi Arias from the perspective of psychopathy. We have a question that was submitted to one of our therapists. Let me read the summary and then I'll read the background information. I never enjoy things, and right now I think it's because I don't feel like I'm living in the moment. So this writer wants to ask what her condition is, what problems, what would be the cause of her feeling like she never enjoys things, or things in life don't make her happy. Life doesn't make her. And from her research, she thinks it might be nihilism, which to her means that she's not living in the moment. It's like has a dissociative disorder. So at this point, let me read to you what she has to say, the background information. I'm having a hard time putting my finger on it, but for as long as I can remember, I haven't been enjoying pretty much anything. Some people might think of this as depression, but nothing at all. I can't bring myself to watch a movie or work on a project I should theoretically be excited about, because I always feel like I should be doing something else. And this always ends up with me doing nothing at all. I live by a daily schedule where I give myself different tasks for different times of the day. For example, doing chores from 4 o'clock to 6 o'clock p.m. But time constantly roll over and I would never keep up. And I don't give myself reasonable time to complete tasks anyway. Just today I was listening to music on a friend's vinyl set, and I just could not bring myself to relax and enjoy it. I felt like I had to be in 10 other places, whether it was finishing up old chores or finishing off another project. Ordinarily, this would mean not much to me, but recently I tried marijuana while watching a movie, and I couldn't be more into it. I felt focused and like I could really process the stimuli right in front of me. I fear developing some sort of addiction because it was the best feeling ever, and I feel as though it would do me good to have that same feeling all the time. So what she's saying is when she tries marijuana, it enabled her to feel relaxed and to focus on the movie. Now, marijuana is a psychoactive drug, like other psychoactive medications, and it will calm you down. Other things will do that. It would indicate that she would respond well to some anti-anxiety drug. But it is difficult to say. Marijuana is a complicated drug, and it has different effects on different people. I know of a case where a client had been diagnosed for schizophrenia and had been taking schizophrenia-related drugs for more than 20 years. He had also been in therapy for a large part of that time through the VA, the Veterans. Anyway, after he had a breakdown of sorts and had stopped his therapy, he had gotten a hold of some money from some work he was doing, and he tried marijuana. He had used cocaine before that on numerous occasions and crack cocaine on other occasions. He said that when he used the marijuana, he could see how bad his life was, how bad his living condition was. He thought he could see life very clearly with the addition of the marijuana. Now, how that affected, reacted, co-reacted, mixed with, balanced the other drugs, the legitimate drugs he was taking, the prescribed medications, we don't know. We could not possibly know. And this didn't last very long because he lost the job where he'd been making the additional money, the money that enabled him to buy the marijuana. And so he was back to his straight medication from the VA. But his therapist thought it was significant because he thought he could see himself better and his condition better with marijuana. So this girl fears developing some sort of addiction because the feeling she had while taking the marijuana was the best feeling ever. And I feel it would do me good to have that same feeling all the time. I think it would do her good to have that same feeling all the time, but not through the use of marijuana. She's saying that her normal life is bad. She doesn't feel good. Nothing makes her happy. She's already said that. Medication helped her. Now, was it legal medication? Did her doctor prescribe this? Was this medical marijuana? Was this something she got on the street? We have no idea. But that's the whole point of therapy, to feel better all the time, to feel good, not to need drugs of any kind, but to feel good. Illegal drugs are dangerous, never think otherwise, and should never be used. It's simply too dangerous. Don't forget, marijuana is listed as a hallucinogen. We are familiar with a number of cases. We are personally familiar with a number of cases where marijuana usage has produced long-term schizophrenia. Now, could we say for sure that marijuana did that? No, we couldn't say it. This wasn't a study, but we are familiar with individuals who got high, whose brains became distorted, who became hallucinogenic, delusional through the use of marijuana, and it never stopped. They never cured it. Long after the marijuana was done, this effect went on. Was it real? Did that really happen? Who could say? Without medical studies, without good scientific studies, we wouldn't know. Without double-blind, controlled studies, we wouldn't know. We couldn't say for sure. But it seems as if it is very dangerous, and I don't think you'll find anything written by a reputable source that would say that illegal drug usage, now I know that marijuana is legal some places now, lots of places really, medical marijuana, so everything is blurred. I think we could all say, and would all agree, that no drug usage is safe. Of legal drugs, psychoactive drugs, we know they have side effects. There's no doubt they have side effects. But since marijuana has been illegal for so long, there's been very little study into the effects of marijuana, positive or negative. But you're not the person to run those studies on yourself. It's dangerous enough to stay away from those drugs, to protect yourself. But you can see how this girl becomes so afraid of becoming an addict because it made her feel so good. I could give you hundreds of first-person reports of people who felt that the use of marijuana was the most awful thing they'd ever done. It frightened them, it scared them. They hated the feeling. This girl loves the feeling, so much so that she's afraid she'll become an addict. Let me finish this letter that she's written. I send this message out because I initially thought this was some sort of dissociation disorder phenomenon, as in not feeling like I'm in the present enough to carry out immediate activities. But I looked up the symptoms, and it's just a whole lot of not what I thought it was. So I'm having trouble identifying this depression, anxiety. Yes, you rarely find depression without anxiety, but life clearly should be better for this female, this woman. Marijuana is not the way to get there. Now, if she had a psychiatrist that would prescribe medical marijuana under his supervision, it might be safe enough to try, or he may find that desirable, but never without a medical doctor who is a psychiatrist, or maybe I should restate that, a psychiatrist is a medical doctor. Not all medical doctors are psychiatrists. With the help of a medical doctor, psychiatrist, it might be something to look at. However, there are many, many other drugs that are anti-anxiety and antidepressant drugs. With his help, or the help of the psychiatrist, you might try various prescription medications, but it is not normal to feel the way this woman is feeling. It's not normal, it's not desirable, it's not acceptable. This woman is the perfect candidate for therapy, especially with a psychiatrist, so that medications can be safely tried. We chose this question because it's so important. How do you know when you need therapy? And I think this question shows you. When nothing makes you happy, when you can't focus, that's the time to get it, if not sooner, but certainly no later. And we also chose it because it talks about the use of marijuana in making this girl feel better, and the danger that she recognized of becoming a drug addict because it made her feel so good. All these things made it a good question so that we could tell you, do not use marijuana. I don't care how safe it is in your mind, how safe your friends think it is. Don't do it. Especially don't do it when you are depressed or anxious. Now, people do a lot of things. People drive drunk all the time and get away with it. And then sometimes they don't and they kill themselves and other people. It's dangerous. This could be dangerous, just as dangerous. So if you feel this way and you know that a psychoactive drug does have a positive effect on you, and marijuana, though it is illegal, it is a psychoactive medication or drug, then a better studied drug, you responded well to a drug, a better studied, better understood, medically controlled drug is worth trying. And perhaps then with therapy and counseling, you could come off of whatever drug you would be on. And perhaps not. But life is not very good right now for this woman. And she seems to have suffered enough. And we know that psychoactive medication has an impact on how she feels. In fact, it can make her feel tremendous. Work with a psychiatrist. If you like this video, you like the topics, you like what we do, subscribe, leave a comment, put a like on the video, recommend it to your friends, pass it on. We are trying to do something positive here, to have a positive effect on YouTube viewers, the people who look at these videos, the people who search out psychological issues, insight, help. We hope we're doing that. Having said that, this is Analytical Media. We will be back. We post quite often as the group can finish the project. Comment, subscribe, like, take care. Hope everything's gone well for you, and I hope things just get better.